Caution. The content of this video presentation pertains only to the specific diagnosis of a sports concussion. If your athlete is experiencing worsening of symptoms such as increased headache, decreased consciousness and alertness, numbness in a part of the body, weakness or loss of muscle contraction in a part of the body, seizure, neck pain or stiffness, vision loss in one eye, confusion and irritability, please stop this video and call 911 or go directly to the closest emergency department. Once again, if an athlete is suspected of having sustained a concussion, they are removed from play and are not permitted to return. Initial treatment for a sports concussion is rest, both physical and cognitive. Physical rest is important because when you are physically active, you are drawing blood away from the brain, which is trying to recover, essentially starving the brain of energy. For the specific diagnosis of a sports concussion, treatment with rest, including naps, is appropriate. Concussed athletes do not have to be awoken from sleep. Also on a case-by-case basis, the doctor may consider treating symptoms with prescription medicine. In addition, some concussed athletes may benefit from specific concussion rehabilitation, including vestibular ocular rehab, specialized exercises that result in gaze and gait stabilization, and balance retraining. Physical rest includes restriction from gym class, sports practice and games, exercise, and weightlifting. Cognitive rest involves avoiding activities that are mentally stimulating, including video games, action movies, crowded places, sports events, reading, computers, and cell phone texting. Academic restrictions may be necessary to aid the brain's ability to recover. Academic restrictions are also important because the student's concussed brain is unable to process information the same way it did prior to injury. This may result in an inaccurate representation of the athlete's true mental capabilities. However, restrictions are implemented on an individual case-by-case basis. As such, not every concussed athlete will have academic restrictions, and not every concussed athlete will have restrictions such as refraining from loud music, video games, or movies. Neuropsyche testing is an important element of sports concussion management, which aids in the treatment and decision-making process with regard to return-to-play protocols. Neuropsyche testing is best utilized with a baseline test, a test of the athlete when they are not suffering from a concussion. The baseline test scores can be used for a comparison in the event of a concussion to ensure the athlete has truly returned to baseline cognitively prior to beginning return-to-play protocol. 3 criteria are necessary for an athlete to be medically cleared after the diagnosis of a concussion. First, the athlete must report no symptoms at rest. As the athlete's symptoms clear with rest, they will show improvements in symptom reporting. In select cases, this recovery may be aided by concussion rehabilitation that involves balance and vestibular ocular rehabilitation. At this time, neuropsyche testing will be repeated and compared to baseline testing in order to determine if brain function has returned to baseline. This is the second criterion, returning to baseline neuropsyche testing. The third criterion is known as the return-to-play protocol. There are 5 levels of physical activity that must be administered and monitored. Return-to-play protocol involves increasing levels of physical activity, sports-specific drills, and eventually practice time, with each level consisting of a 24-hour period of time. It is very important to monitor and document each stage to ensure that standard care has been met and the athlete has remained asymptomatic during the protocol. Once the athlete has successfully completed the protocol, they are now safe to return to play. Only at this point is the athlete medically cleared of the concussion and able to safely return to sport. Concussions take time to heal. Every concussion is unique. One cannot predict how long it will take to recover from a concussion. As such, every athlete is treated on an individual basis.